Let's invite Representative Davis and Representative Turner up to the stage. Come on up. So, Representative Davis, let me just start with the question about the state of the state, since it was recent and you maybe haven't had a chance to reflect on it all. And I have no idea what was said other than the pre-media reports. Tell us what you heard from the governor today in the State of the State address and what you think we all should know about it.
I would begin by saying that I was very relieved about what was said at the State of the State. I think the governor focused on issues that are important to Texans and everyday Texans, unlike in previous sessions where we had the bathroom bill being an emergency item or a series of very partisan issues. The governor, I have my notes, made the first emergency item was school finance and teacher pay. And educating our children, that's one of the most important things we do as a state. So to start off with saying we're going to prioritize public education finance, I think sends a great signal. School safety, also, very important. And then what would be probably very key to this group is that the Mental Health Consortium, listing Senator Nelson's bill as an emergency item is going to be, I think, great for the state of Texas and for our public health. We also heard the property tax reform. That probably has some mixed reviews about that. But of course, as a Houstonian and as someone who represents an area that was devastated by Harvey, I was, of course, happy and thrilled that the governor would put that kind of restoration as an emergency. So I was really excited overall with the tone and the tenor and the ideas that the governor was talking about.
Yeah,
I think it's so far everything seems to be going very well.
So far, so good, right?
So far, so good.
Representative Turner, so far, so good? Or as one of the leaders in the House Democratic Caucus, do you have a different perspective?
Sure. Well, first off, good afternoon. It's great to be with you. Appreciate the opportunity to be here. And I agree with much of what Representative Davis just said in reaction to the State of the State address. I just came from actually helping deliver a Democratic perspective on the address or response. And, we all agree that public education funding should absolutely be priority one. It was great to hear the governor say that, and I know I, for one, am looking forward to working with him and all of our colleagues to try to achieve that. I think there's some unanswered questions about how some of the dollars and cents will add up, particularly when you get into the property tax revenue cap concept. But we'll be able to have those debates. I would say if there was a criticism from my perspective, and while I agree on the mental health care, I thought it was absolutely fantastic that he focused on that and made it an emergency item. I didn't hear a lot on health care in general, and the fact that Texas has the highest uninsured rate, number of uninsured of any state in the country. There was no discussion about what we're going to do about that to see that more people have access to affordable health care, and that's something that obviously is a focus for myself and a lot of other members of the legislature that we want to work on. So broadly speaking, the priorities he laid out in terms of public education, property taxes, Hurricane Harvey relief, which is very, very important, mental health, school safety. Those are all things we can all agree with, and hopefully we'll be able to work out the details on them.
So, Representative Turner, let me ask you to validate or dispute the counsel of an old Austin hand that said, "Don't believe the hype, DJ, that the fight is not between Democrats and Republicans. The fight is between the House and the Senate." And that's where the contentiousness is. Do you feel like that's accurate? I mean, obviously there's division between the parties, but is the real tension between the House and the Senate? And do you find that you're hearing more moderating things coming out of the Senate this year as compared to years past?
Yeah, it's a great question, and I would agree that some of the time it is a House and Senate division more than a partisan division. I think that so far it is generally more encouraging what we're hearing this year from the Senate. For example, on public education. We're hearing talk about a across-the-board teacher pay increase out of the Senate as opposed to a private school voucher system, which is what we heard about a lot about last time. And so I think it remains to be seen where this goes, but I think, if you think about last session, the House passed on a bipartisan basis a public school finance reform bill, both in the regular session and again the special session. The Senate wanted no part of it and refused to pass it in its form in the form we sent it over in. So that's an example of where Democrats and Republicans agreed in the House and it just didn't get any traction in the Senate. There's some things that happen the other way. So we'll see where it goes. Hopefully there'll be better cooperation between the two chambers than there was 2 years ago.
Yeah. Representative Davis, you've been, I think, a real leader on a number of issues and stand out amidst or among the Republican Party as...
And I've fought a lot of these, like Republicans, Democrats, the governor, the Senate. The list keeps going. But.
Yeah, I'm getting to that because you had an active election season with some of your friends on the left and some of your friends on the right. Some of the friends that you've heard from today on the right. What is the state of the Texas Republican Party, particularly in the legislative caucuses? Is it more unified coming out of 2018 midterm elections, or is there still a real division maybe between more social conservatives, more business folks? How would you characterize it?
I think that the division is definitely real, but because we're still so close from those November elections, there's a lot of fear. And so Republicans, I think, are trying to learn something from the 2018 elections. And I think they're doing a good job for now. But when we have conversations, I've had, asking the chairman of our party, what is being done to recruit and support female Republican candidates. I'm only one of 6 Republican women in the House, and when I started, I was one of 18. So our party's has a real, what I'm hearing is that the party has a suburban issue because we lost the suburbs, and I say, no, you don't have a suburban issue, you have a woman issue. You lost suburban women in this last cycle. So I'm pleased that I'm hearing at the beginning of session issues about public education, mental health, and Representative Turner's right. There was an absence of any public health other than the mental health component in the state of the state. But I'm still, I mean, I know what's coming because I've been here a couple of sessions, and I'm hopeful that we can stay where we are and focusing on the things that we're focusing on now. But if we don't, then I think 2020 will be an even more difficult time for Republicans.
Yeah, there's no big primary in 2020 that would push. I don't think Senator Cornyn's getting the primary. There's no big primary that would seem to me to push Republicans farther to the right in this session. But it does seem like it's a precarious, there's a lot of good talk, but it seems kind of precarious given the last few years. I think what I'm hearing is you kind of feel like it's precarious also, Representative Davis. And
yes, I'm cautiously optimistic, but I'm also a realist, and I can just see at some point during the session there's going to be, and if we're going to be honest, I would assume that there is going to be an issue regarding immigration. Yeah. And that will essentially tear at the fabric of what we have been building up until then, if I had to predict. But everyone's talking about public education finance, but I see former congressmen on the floor of the House, and I say, well, what's going on over there? Oh, they're working on the big heartbeat bill. So I'm like, well, I guess we haven't learned our lesson from November if this is what members are going to, spend their time focusing on.
The heartbeat bill being a bill that recognizes life upon the audible reception of a heartbeat, right? Representative Turner, there are a number, as you alluded to, there are a number of healthcare bills that Democrats have dropped in the hopper, so to speak. Some legislation or some ideas coming from the Republicans are, also constructive, related to things like mental health, like Representative Ford Price is a leader on that. But some of those expansion bills the Democrats are advocating for, or other bills that would expand coverage in creative ways. Do you see those getting much traction in this legislature, or are those sort of marker bills, sort of tokens to set out a policy position, but which may not really move through the system well?
Well, I think you're right. There's a number of leaders on healthcare issues in the House, and frankly, in both parties. And I agree on Fort Price. I'd be remiss if I didn't say Representative Davis is a leader on healthcare, and I'm pleased she's back as subcommittee chair of Article 2. I hope that doesn't hurt you. I said that.
No.
but she does a great job and understands the intricacies of our healthcare system in Texas. Whether things get traction, I think time will tell. Democrats. Here's what I can tell you as with my Democratic Caucus chair hat on, is Democrats are going to continue to push to expand coverage in Texas, and there's a variety of ways to do that. The most effective, efficient way we can do it is expand Medicaid under the Affordable Care Act. And there have been a number of bills filed, as you alluded to. Chairman Garnet Coleman has filed a very comprehensive bill that would not only expand Medicaid, but also enshrine some of the protections of the ACA into state law, such as pre-existing condition provision, for example. And we're going to continue to fight for those things. But that said, we know we're in the minority, even though we've picked up seats. We're in the minority, and so anything that we're able to accomplish is going to require bipartisan support. So hopefully, we'll be able to find an opportunity to gain some bipartisan support on some of these provisions, whether it's overall coverage, whether it's addressing maternal mortality, whether it's addressing postpartum coverage, or mental health. And there are a lot of different things we can work on, and hopefully some of those things we can work on together.
There's no shortage of targets and topics, right?
Yeah, and I think we have a unique opportunity this session, as Chairman Turner mentioned, dealing with postpartum benefits. I know that there have been 6 different pieces of legislation filed to extend Medicaid benefits to women for up to a full year as opposed to 60 days after she gives birth. I actually filed my own. So technically there is bipartisan support, depending on what you think of me. There is bipartisan support for extending the benefits. Words have meaning. So to extending the benefits, Medicaid benefits. So I think that's a good place to start with the discussion in terms of an expansion population. I don't think you're going to be able to get a full Medicaid expansion in one session. But I know that last session I passed legislation that expanded postpartum depression screening for a full year after mom gives birth. So it was sort of like, okay, we did that. Now can we get some more health care other than postpartum depression screening? So I think we're moving in that direction. Anyone who's not, you can't ignore the fact that we have this huge uninsured rate, that people are showing up to our emergency rooms, and that we're paying for their health care via your hospital districts, through your taxes. We're paying for this care. And it's just that's not obviously the most efficient way to deliver that care. So I think that there's some hope, and I'm really thinking that with focusing specifically on the maternal mortality component is where we might find the most success.
I think that I know everyone here is really hungry, and so is busy eating. I think that's a really smart observation, and I just think we all should appreciate the complexity and the nuances of trying to push reform in a very politically charged environment where you have to be mindful of things like expanding versus extending care of up to 1 year, and the sort of radical nature of incrementalism and trying to move the ball forward over multiple years. This is a little far afield, but Representative Davis, let me ask you about the Commission's procurement of Medicaid. And it has been an ongoing challenge.
Challenge is a nice way to put it.
Yeah, I'd love to have your thoughts as an appropriator. How do you know that Texas taxpayers are getting, good value for the Medicaid spend when there are these ongoing procurement challenges that exists between the legislature and the beneficiary. It seems like getting the money down is sometimes a challenge. What do you think?
I would say that you're not getting your taxpayer dollars worth with some of these different vendors and in some of these populations. And it's not because I think that managed care doesn't work or is a bad model. I mean, we're a managed care state. We're going to remain a managed care state. But I feel like the agency has not evolved into a managed care agency. It's still living in a fee-for-service mentality. And the state is we're no longer a provider of services, right? We just contract monitors and procurement specialists, which we are lacking the experience in state government. So I think that HHSC has gone through many audits. I mean, every time there's an examination, there's always a problem. I don't know how many contracts within the last year or two have been canceled just because of procurement issues. And that's something most people would never know. Like, you just have to kind of be connected to the agency to know that they've had to cancel a contract. So I think that the agency does have issues. I think that in a population that's relatively healthy, it does well. Managed care does well. But when you're looking at specifically medically fragile children, this system is not working for them. And we are paying, a premium to the MCOs to provide the specialty care that these kids need, and they're not getting it. The Dallas Morning News had a series of articles that went through it. We had a joint hearing with the General Investigating and Ethics in Article 2 that kind of exposed a lot of bad practices. So we'll have a bill. Probably.
There ought to be a law, right?
There will be. Yeah. And it's based on some lessons that we think we need to learn. But I think to me, that's one of the most important issues that we, as an Article 2, as a taxpayer, is the billions of dollars and the lack of accountability that I feel that we have a state. So, I mean, I can't even get, if we want to get basic information, the first thing the agency does is say, well, let me call the MCOs and we'll, get back to you. Whenever I'm drafting legislation and there has to be a fiscal analysis, what does the agency do? Well, we'll call the MCOs, and then they get to decide the price tag of the reform that you want to make. So
wow, that's pretty frustrating as a citizen legislator to not be able to get simple questions answered.
Yeah, I think so.
Representative Turner, let me sort of go from the kind of fine-grained detail to a little more high-level view. As a leader in the Democratic Party, not the party, well, the party, but also specifically the caucus in the House in Texas, what counsel would you provide to one of the 35,000 people running for president on the Democratic side of the ticket? I would argue that it's very unlikely in a crowded field that any Democrat will get through that presidential nomination process without having some sort of Medicare for all or single payer or public option, some sort of, position that 10 years ago was considered too far left for Congress, but is going to be probably central to the Democratic nominating process for those Iowans and the caucus in February. What do you think as a leader out of Texas in the Democratic Party about that?
Well, I don't know that I'm qualified to give any advice to people running for president, but I'll give it a shot. I think, Democrats have long said, whether in Democrats across the country or here in Texas, that health care should not be a privilege. Everyone should have a right to access health care, and that ought to be our goal through policy. I'm of the opinion that between the traditional Medicare system and the reforms made under the Affordable Care Act, that we were getting much, much closer once the ACA was fully implemented. Now it fell short because of the Supreme Court decision that made Medicaid expansion optional in the states, and so obviously states like Texas have not fully realized the benefits of the ACA. But it's unquestionable that millions of Americans, including more than 1 million Texans, have health insurance today who did not before the ACA was passed, and that is progress in a very meaningful way. And I hope that Democrats running for president, even if they have a better idea or a different idea, will acknowledge the tremendous step that was taken with the ACA, because I think that's important. So I think it's very appropriate. I think every Democrat running for president needs to talk about how we're going to expand health care access. If someone's saying we're going to do Medicare for all or a single payer, I think that's a debate we can have. They're going to have to answer how it's paid for, because I think that's really important that the primary voters and the American people understand how something like that, what it would cost and how it would be paid for. And maybe there's a great answer for that, because, people asked the same questions of President Obama when he was running, and he was able to answer it, and the ACA has saved the federal government money over the last 8 years. So that said, I think there is always going to be a role for the private marketplace insurance industry, and I don't think that's going to change. And I think the bottom line objective needs to be, how do we expand coverage to where no one goes bankrupt because they get sick or get injured, and where people can go get preventative care, so they don't end up in the emergency room and cost the system 10, 20 times what they would have otherwise.
So do you think in a wave year, or an election that was called a blue wave year and where Democrats picked up seats in the legislature, do you think that Beto O'Rourke's campaign was perhaps too strident on healthcare and expanding access for Texas?
Too strident?
Yeah, too far left, supporting universal access or single payer of some nature?
No, I don't think that. I don't think his position on healthcare was the reason he didn't win the election. I think that saying universal access to health care is a perfectly reasonable position to have. Again, you got to provide some details about how that's achievable. Look, I think I get this question a lot about why did Beto lose? Well, I think you can point to a number of different factors, but the fact is he got closer than any Democrat has gotten in 25 years, well, 20 years actually. So he deserves a lot of credit for that. And I think that there are probably a few things done differently, and the outcome would have been different. But I don't think it was a healthcare position, or frankly any specific position was the reason that the outcome was what it was.
Yeah.
I think it was a year that he did. There was a lot of energy out there, and he and a lot of other candidates did very well, better than expected.
Yeah.
I will say he actually won my House district by double digits. So.
Huh. Speaking of 25 years, it's been 25 years since Texas had a woman governor. Think there should be a woman running for governor in a few years, Representative Davis?
I absolutely. I mean, I think that women should be running for office at all levels.
Have you given any thought to what you want to do after the legislature?
No.
You don't have an announcement that you want to make about 3 years from now?
No, I'm just right for
Yeah.
my House district.
Good. Representative Turner, what do you communicate to your Senate colleagues? Going back to this idea that there's maybe still some division between the House and the Senate that will play out when crunch time really hits. What counsel do you give to your Senate colleagues to try to keep this session as constructive as possible?
Yeah. Well, I think it's a couple things. I think let's focus on what we agree on, the big issues.
You show them their election results.
That's another way to do it. Let's focus on the big issues: public education, higher education, healthcare, infrastructure, disaster recovery, like the governor talked about today. If we keep the focus on those big issues that the vast majority of the people of this state care about, I think we're going to make progress, because we may not agree on the details, but we can work that out. And we at least agree on what the issues were. Last session, there was no agreement about what the issues were. The House was talking about public education, the Senate was talking about bathrooms. I mean, they're just two totally different universes that we saw last time. So far, I'm seeing less of that in this session. Again, it's early; things could change. But I think that's encouraging. So I'm just going to continue to push for, let's focus on the really big ticket items, the big bread and butter issues, and try to make some headway there.
Yeah, good. Representative Davis, how about you in terms of your counsel to the new speaker? What advice do you give him?
That would be so presumptuous. I would never, that would not even be a conversation I could imagine having.
What would you hope? What would you hope to see from this speaker, Bonin, versus Speaker Strauss? What should the new speaker, learn from the past speaker?
Well, I think that Speaker Bonin has, conducted himself in a way so far that I think is actually great for the House. His Speaker pro tem is Joe Moody, who's a Democrat, Chairman Chris Turner, Chair of Higher Ed. It was not with like a heavy hand that he made committee assignments, and I think he did just an amazing job letting the body know that he understood the election results, that the Democrats just picked up 12 seats, and they are coming, to this body with more strength and more power. And I think he made those decisions appropriately. It's hard to say because I think that he's done a great job. I think Joe did a great job. I think that what happened with Joe was the governor and the lieutenant governor essentially elevated him to a statewide and then made him this, the boogeyman of the conservative party, and wanted to blame Joe Strauss for everything. By Joe stepping away, he's allowed for this reset to take place between the House, the Senate, and the governor. So in a lot of ways, I believe that I'm still thankful for Joe Strauss, because I don't believe we would have had a state of the state that talked about public education, finance, and safety and mental health, but for Joe Strauss.
Wow, very interesting. And that it took him stepping away for that to happen. Yeah. Questions from you all out there?
Yes, hi, I'm Laura Rosen with Central Health, and I work on the 1115 waiver. In about 2.5 years, billions of dollars annually, we have uncertainty about that funding for the uninsured in Texas. And I was just curious if, the legislature is talking about that and starting to plan for that. And, if there's anything you all are doing.
Okay, yeah, so that's a great question, and actually I had some folks with the Texas Hospital Association. That's who I was meeting with before I came here today, and the disparate projects were one of the issues that we were talking about, and what do we do with that population once those projects go away. So it is a discussion that we are having, but that's kind of, I can just say, yes, we're having that discussion. One of the bills we filed this session is to perform an analysis of all those disparate projects so we can figure out what's working and where, and what are the good programs and what are the not so good programs, so that then we can move from there to figure out what we do with that population that's receiving those services. So yes, it is a discussion, and there are some of us that are very aware of, what could happen in 2.5, 3 years if we don't start planning for that. But what that looks like right now, I don't have an answer at this point.
Yeah, I thank you for raising that and for your work on the 1115 waiver. I think to echo what Representative Davis said, I know in my area, North Texas, Dallas-Fort Worth area, I've been able to have some briefings and see some demonstrations of some really seemingly very effective district projects that, and the goal, as I always understood it with the 1115 waivers, to do these different projects, see what works, see what is really making a tangible difference in healthcare outcomes, and then be able to replicate those on a larger scale. So at the very least, I hope we're going to be replicating things on a larger scale that have proven to be successful. But on the subject of waivers, I'll just go back on the Medicaid program really quick. The CMS, both under the Obama administration and including in the Trump administration, have continued to grant states various waiver programs to implement some sort of Medicaid expansion. It doesn't have to be, it's not a one-size-fits-all solution. Different states have found ways to draw down that funding with different approaches and different waivers they've received from CMS. And I just continue to urge our state leaders at the commission and in the governor's office to look at that possibility of drawing down some more federal dollars to expand coverage options in Texas.
I think that's like a 90-10 match for that population. But obviously, I think a third of all of those waiver or those demonstration projects are mental health related. So since we clearly have an emergency item about a mental health issue, I would assume that that's something that the legislature is going to be able to do some productive work in.
I want to just say that we have the real honor of hosting a wide range of legislators, and I would put the two of you really very much at the top of those. We don't disparage anybody. We really like everybody, but you guys
Who
are
don't
really,
you like?
I love you too. So Representative Davis, Representative Turner, thank you very much to both.
Thank you very much.
Thank you.
Thank you guys.